Hello, my name is Dr. Eduardo Pino. I'm Associate Professor of Pediatrics at the Jones C. Edwards School of Medicine at Marshall University in Huntington, West Virginia. We're going to spend quite a few hours discussing pediatrics. Everything that we're going to discuss is high yield. Some things will be higher yield than others. Some things will be mega high yield and ultra high yield, and you'll be ready for the exam once we're finished with this. We'll start off today with the newborn. First thing you need to remember for the exam is the Apgar score. The Apgar score is an evaluation of the newborn. It is given at 1 minute and at 5 minutes. It's a score that was developed by an anesthesiologist by the name of Virginia Apgar. And the mnemonic for the Apgar score is Apgar. Appearance, pulse, grimace. Grimace is when they stimulate the baby and it either cries or coughs or gets really mad. Activity, which is muscle tone, and respiratory effort. The score is 0, 1, or 2. It's there on your table. And it is given as an assessment of the baby. The 1 minute score is basically an assessment of the intrauterine environment. Remember that babies are at the mom's mercy. And so that if the mom, for example, received general anesthetic, the baby may have some respiratory depression because that drug crosses the placenta. The 5 minute score is basically a transition score from the intrauterine environment out to the regular environment. The score can also be given every 5 minutes afterwards. It helps you with your resuscitation. So that if you have a poor score, you may be resuscitating the baby, and you can use that subsequent scores to help you assess your resuscitative efforts. The Apgar score is not predictive of outcome, although very low Apgar scores can sometimes be associated with neurologic problems. The way that you might get an Apgar question is that you might actually say, the STEM might say, a baby is born with the following, and it'll mention 5 things, and you'll have to tally up the score, and it'll say what the Apgar score is. You'll say 5, 6, 7, 8, 9, whatever. A poor Apgar score is basically about 0 to 4. 5, 6, and 7 is regarded as a fair Apgar score. 8, 9, and 10 are good Apgar scores. Besides neurologic outcomes, sometimes low Apgar scores may be associated with other things, such as necrotizing enterocolitis in a preterm baby. So it's therefore important for you to realize what the Apgar score means when they give it to you as part of the information in the stem of the question. If they tell you the baby has a scores of 4 and 8, that tells you that the 4 was not a very good score, and then you can start formulating your differential diagnosis.